Hello, everyone, and bonjour à toutes et tous. In Canada right now, there are 5,153 cases of COVID-19, including 55 deaths. In addition, at any point in time, there are many other people under investigation, awaiting laboratory results, or not yet tested. So even if you are not hearing of cases in your community, it doesn't mean there are no cases, or that there are no exposures waiting to happen. We have now completed tests for over 184,000 people in Canada, which is more than 84,000 additional people tested since Monday. In terms of the severity of COVID-19 in Canada, the percentage of cases that require hospitalization is approximately 7%. About 3% are critically ill, and 1% of cases have been fatal. Please note that 30% of those hospitalized are under 40 years of age. We continue to keep a close eye on the severity of the disease because although there will be day-to-day fluctuations, a sustained trend of increased severity could point to a higher rate of infection in vulnerable populations or that the health system is being overwhelmed. I am reminding Canadians not to underestimate the severity of this disease. The devastating impacts of COVID-19 is evident in Europe and parts of the United States. At the same time, there are signs of hope. There is a note of cautious optimism from British Columbia, the area of Canada that first experienced community transmission. It is still too early to know for sure. But after weeks of public health interventions, the rate of growth appears to be slowing. We will be closely looking at BC over the coming week for better clarity on the effect of their public health measures. This early sign of reassurance should spur us to keep up with our new habit of physical distancing, despite the accompanying hardships. So we need to stay the course. Yesterday, we started a challenge for Canadians to build a bubble of protection and stay inside that bubble. We need to maintain this zone of protection around us to keep the virus out. Each of us should ideally have our own separate bubble that is a 2-meter circumference around us. But for couples, families, and other cohabitation situations, that bubble might mean 2 or more people, or keeping within a bubble that no one else comes into. So the important thing is to stay in your bubble and not burst someone else's. I'd also like to ask people to just check out our canada.ca website for a new interactive map on cases in Canada, as well as a more detailed epidemiologic report that's now been posted in our 2 official languages. Thank you.
Bonjour. Au Canada, 5 153 cas ont été déclarés, dont 55 décès. Par ailleurs, à tout moment, de nombreuses autres personnes font l'objet d'une enquête, attendent des résultats de laboratoire ou n'ont pas encore été contrôlés. Même si aucun cas n'est signalé dans votre collectivité, cela ne veut pas dire qu'il n'y a pas de cas ou que vous êtes à l'abri de toute exposition. On a des résultats des analyses laboratoires pour plus de 184 000 personnes au Canada, soit plus de 84 000 personnes supplémentaires depuis lundi. En termes de gravité de la COVID-19 au Canada, le pourcentage de cas devant être hospitalisés est d'environ 7%. Les personnes gravement malades représentent environ 3% des cas et 1% des cas ont été fatals. Nous continuons à surveiller de près la gravité de la maladie. Malgré les variations quotidiennes, si la gravité présente une tendance à la hausse, elle pourrait traduire un taux d'infection accru dans les populations vulnérables ou un débordement du système de santé. Je souhaite rappeler aux Canadiens de ne pas sous-estimer la gravité de cette maladie. Les effets dévastateurs de la COVID-19 sont évidents en Europe et dans certaines parties des États-Unis. Il y a aussi des signes encourageants. La Colombie-Britannique, où la transmission communautaire est apparue pour la première fois au Canada, parle d'un optimisme prudent. Il est encore trop tôt pour le savoir avec certitude, mais après des semaines d'intervention en santé publique, le taux de propagation semble ralentir. Nous surveillons attentivement les situations en Colombie-Britannique au cours de la prochaine semaine afin de mieux comprendre l'effet des mesures de santé publique qui y ont été prises. Ce premier signe encourageant devrait nous motiver à maintenir notre nouvelle habitude de pratiquer l'éloignement physique en dépit des difficultés qui en découlent. Il faut garder le cap. Hier, nous avons lancé au Canada le défi de créer leur bulle de protection et de rester dans cette bulle. Nous devons maintenir cette zone de protection pour empêcher le virus de nous atteindre. Chacun de nous devrait idéalement avoir sa propre bulle d'environ 2 mètres de son circonférence. Cependant, pour les couples, les familles et les personnes en situation de cohabitation, cette bulle peut inclure 2, 4 ou encore plus de personnes, toutes isolées dans une bulle où personne d'autre n'entre. L'important, c'est de rester dans votre bulle et de ne pas faire éclater la bulle de quelqu'un d'autre. On encourage aussi tout le monde de visiter notre site web canada.ca. Merci.
Thank you. We will now open the telephone line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics to ask your questions. Operator, over to you for one question on the line.
Thank you. Merci. Please press star one at this time if you have a question. The first question is from, la première question is de Lauren Gardner de Politico. Your line is open. Votre ligne est ouverte.
Hi, thanks for taking my question. I'm wondering what kind of advice you might be providing to federal officials and maybe even officials at the local and provincial levels who may be concerned about the U.S. relaxing certain social distancing measures in the coming weeks. There have been reports of mayors in border towns who have expressed some concerns. Is there any direct advice you've been able to provide to them thus far about how to handle that possibility?
Absolutely. We are monitoring what is going on in terms of the actual outbreaks in the United States. And of course, there are many different areas of the United States that are quite heavily impacted by COVID-19. So I think, as everybody knows, that there are now border measures to reduce the impact of any illness that might come from travelers in the United States. And those are layered measures, and certainly no non-essential travel between the two countries is very key, while maintaining essential services and those links that are so important between the two countries. But we've also, as you know, have now a mandatory quarantine order in place, emergency order, that essentially mandate those travelers to undergo 14 days of self-isolation, so that's mandatory isolation if they've traveled anywhere, including the United States. We will be, of course, isolating anyone who is sick coming from any country, and that includes the United States as well. And the Quarantine Act, the Federal Quarantine Act, comes with it quite heavy penalties if people were not observing that order.
And one follow-up?
I'm set, thanks.
Okay, operator, next question on the line.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque de la Presse canadienne. Your line is open. Votre ligne est ouverte.
Oui, bonjour. Mes questions sont en français pour M. Njoo. Hier, vous avez, disons, peint un portrait peu reluisant de la situation actuelle. Vous avez dit qu'on en aurait pour des mois. Je me demandais concrètement à quoi les Canadiens peuvent-ils s'attendre? Est-ce qu'on parle d'un isolement prolongé de plusieurs mois? Est-ce qu'on parle de période de quarantaine sur une période de 1 an, 18 mois? Qu'est-ce que vous pouvez leur dire?
Merci pour la question. Comme j'ai constaté juste il y a quelques minutes. Oui, on ne peut pas prévoir qu'est-ce qui va se passer à l'avenir, mais on a, comme on dit, les signes encourageants. Qu'est-ce qui se passe actuellement en Colombie-Britannique? On voit que le taux d'incidence, le nombre de cas est diminué. Et c'est l'évidence que peut-être on commence à aplatir la courbe en Colombie-Britannique. Et c'est même à l'échelle nationale. Donc, je pense que c'est important que tout le monde ne lâche pas. Il faut, ce qu'on dit, il faut garder le cap. Il faut continuer avec nos mesures d'éloignement physique. Et peut-être c'est plus facile pour garder qu'est-ce qui se passe d'une semaine à l'autre. Pour voir qu'est-ce que c'est quoi les effets de nos efforts collectifs pour ralentir la propagation du virus.
Et suivi?
Oui, tout à fait. Et mon autre question, c'est à propos de cette annonce faite par M. Trudeau aujourd'hui. Donc, on dit que les Canadiens qui seront malades ne pourront plus embarquer là, sur des avions ou des trains. Je me demandais, comme responsable de la santé publique, comment est-ce que les employés de ces compagnies aériennes ou sur rail doivent évaluer la situation? Est-ce qu'il faut prendre la température des gens? Qu'est-ce que vous leur dites en ce moment?
Merci pour la question. Je pense qu'il y a deux aspects. C'est fait longtemps, on a dit que c'est important pour tous les Canadiens. Si vous êtes malade, restez à la maison. Je pense que c'est aussi comme une attente que tout le monde va suivre les directions des autorités sanitaires pour rester à la maison. Je pense que pour les gens qui travaillent pour les lignes aériennes, c'est comme aussi à l'étranger. On va surveiller les personnes avant l'embarquement pour voir est-ce que quelqu'un a vraiment des signes d'être malade. Mais en fait de compte, c'est pas une garantie de 100%. Et je pense que le message le plus important, c'est vraiment pour tout le monde. Si vous êtes malade, prenez pas un voyage, restez à la maison. The question was,
Thank you.
in English? Okay, the question was for what should, I guess, companies train in airplanes, et cetera, for domestic travel that the Prime Minister just announced. What we're saying is that the message is really, in a sense, at the core, no different. We've been saying from a public health perspective for several weeks at least that if you are sick, stay at home. So really, I think there is an obligation, I would say, a civic duty for people to understand that if you are sick, you should not be taking a commercial travel means such as an airplane, a flight, or taking a train to go anywhere in the country. You should be staying at home. Of course, the people actually are the personnel working for the airlines and the trains. They will do their best. They'll look at people who want to board and look for obvious signs that someone's ill, etc. But in terms of very systematic screening, there's no guarantee. You know, people can always hide symptoms, take Tylenol. So I think at the end of the day, it really comes down to our collective understanding and collective, I think, motivation and approach to do the right thing. If you're sick, don't travel. Stay at home.
Thank you. Now we'll take a question in the room.
Hi, Ashley Burke, CBC News. Can you tell me about plans to run field hospitals, why they might be needed down the line, and how soon are you estimating that they would be needed in Canada?
So that's there's a significant amount of planning in the provinces and territories. A good example would be from British Columbia, even yesterday, where they have very systematically planned out different scenarios and exactly how much capacity they have. Public health is going to do whatever it can to reduce the impact of this epidemic so that you don't go beyond your capacity to cope. Having said that, of course, you have to prepare for much more worst-case scenarios. So those things are absolutely happening in the provinces and territories. We've been in contact with them on a daily basis. So they are already planning alternative care sites, how to care for people who are not so sick outside of the hospitals designated for COVID-19, for example. And so the idea is to already they're freeing up ICU beds and also the intensive care, more serious illnesses have to be taken care of in a hospital setting. and then how to look after people who could be looked after in more alternative sites. So all of that is at play, even though right now Canada is coping. So those calculations, I would actually encourage people to just have a look at the example of British Columbia, where the numbers are actually quite well articulated.
My other question is, you talked about the optimism in BC and the modeling done there. Will the federal government be sharing their same sort of modeling publicly with us?
Yes, so absolutely. As I said, there's an epidemiologic report that's already being posted. At the federal level, we have to take into account a national picture, which I think is very important, and looking at how we are trending in comparison with other countries that have gone before us, if you like, and looking at their experience and where we're tracking. So that is absolutely the intent. I also want to flag that the national aggregated picture must be supplemented by the provincial and local picture, because different areas of Canada are actually experiencing this outbreak. It's just slightly different trajectories and timelines. So unpacking what's underneath a national picture, I think, is very important. So I am, of course, very happy that British Columbia has done that. We've been supporting different provinces to do their own projections as well.
And sorry, when are you planning on releasing that publicly?
Well, some of that data is already now, since today or last night, already on our website. We'll be making as much of that available as possible. I'll have to just caution that, of course, modeling is modeling. That's just, planning scenarios. What you have to look at is the epidemiologic report in real time, where things are trending.
Thank you. Next question in the room.
Hi, Ian Wood, CTV News. Today, the Prime Minister announced that there's going to be further screening on domestic travelers, air travel and train travel. Should we not be taking these steps at a local level? I mean, what good is it if we're screening someone traveling a long distance within Canada, but not someone, say, getting on a public transport bus or riding in a taxi?
So there are, I think you would actually observe that all across Canada, the provinces and the municipalities are taking this really seriously. They're already stopping gatherings. They are advising this 2-meter distance on transportation. And so that includes buses and other things, where as much as possible you're doing physical distancing. So all of those measures are already being implemented in the local jurisdictions. While maintaining as a balance, society does have to go about as much as possible maintaining essential functions while doing physical distancing. But obviously each of the municipalities, the cities, in very different situations. Toronto isn't going to be the same as a more rural area, for example. So I think that every level of government is doing whatever it needs to maintain that physical distancing.
If I could just add to that, my previous answer is that certainly governments, companies, and so on can put whatever measures in place. They're never going to be foolproof. Someone can hide symptoms and so on, take a Tylenol if they do have a fever. So I think at the bottom line, it really is, I think, the collective responsibility, but for each citizen here in Canada to understand, appreciate, it's important that the important role they can play. If you're sick, stay home. Don't take public transportation.
And one follow-up?
Yeah, my second question was on with regard to the United States. Obviously, it's a bit of a wildfire situation there. Cities like Detroit are hotspots, also in Washington State near the border. I know you've spoken a bit about this, but there has been concern addressed by, say, the city of Windsor across the river from Detroit. Should we be satisfied with the ban on non-essential travel, or do we need to step up our border enforcement and border closures with the United States, granted that the somewhat reckless direction they're taking?
So I've just said it's not just reducing the non-essential travel. We do have a emergency order under our Federal Quarantine Act that then are ordering travelers to isolate if they're sick, but also mandatory quarantine or essentially of anyone who is asymptomatic. So they will have to go directly home, depending on if they have a home, and if they don't have a home, the federal government will be housing people in our federal quarantine facilities. So, and as I said, the penalties are pretty heavy. Now, let's just say that even on a daily basis, we do have instances. We have truck drivers who have been stopped and been put in a federal quarantine site because they've shown even mild symptoms. So that's happening in real time right now. And then they get tested, and then if they're okay, they can continue. If they're not, they're staying at our quarantine sites.
Thank you. Operator, over to the line for 2 questions.
Thank you. Merci. The next question is from Theresa Wright from the Canadian Press. La prochaine question est de Theresa Wright de la Presse canadienne. Your line is open. Votre ligne est ouverte.
Good afternoon, Dr. Tam. Yesterday we heard that the number of patients in ICUs doubled in Ontario in less than 2 days. How concerned are you about this spike, especially considering that ICUs were the first parts of hospital systems to be overwhelmed in places like Italy and Spain?
Yes, so I think that's, as I said, we have to monitor the severity of illness very carefully because if there's increase in critically ill people, the key spike is going to occur if health systems are overwhelmed. So having enough ICU facilities is very, very important. So that has to be tracked. Right now, all jurisdictions are coping with the numbers, but they are planning to do more. Even Ontario and BC and many jurisdictions have actually emptied out probably about half of the ICUs just to make sure that they are already prepared for any influx. But of course, from a public health perspective, we just do not want people to end up in the ICU. So on the prevention side, based on what we understand, a lot of the ICU patients in a number of jurisdictions are people, say, from long-term care facilities. They are the older population and people with underlying medical conditions. And that's why we've really, really stressed that we have to protect these populations. Otherwise, we would have more ICU admissions. So I think unpacking the epidemiology underneath the people who are being critically ill does show us that they are the vulnerable and they are the elderly. And so long-term care facilities, making sure that nobody sort of introduce the virus there. And absolutely no introduction into hospitals and other places where vulnerable people go. But also on an individual level, do not go anywhere near someone who's vulnerable or older in your family even, or your friends. Do not try impact them because you will see increase in serious illness if that is the case. So maintain that bubble and definitely keep the bubble away from anyone who is vulnerable. But based on what I've seen so far, the health system is able to manage their patients.
One follow-up?
Yes, and just on the announcement today from the Prime Minister on passengers on domestic flights and trains not being allowed to board if they're showing symptoms, can you provide any more details about exactly how that they will be screened and how those new powers being given to airline companies and train companies will be enforced?
So I think those details will come in the coming days, and obviously working very closely with the Minister of Transport, and that is the, that I think the media and the public will get the information as that unfolds. So stay tuned.
Thank you. Operator, next question on the line.
Thank you. Merci. The next question is from Mélanie Marquis from La Presse. La prochaine question est de Mélanie Marquis de La Presse. Your line is open. Votre ligne est ouverte.
Merci. Docteur, juste un peu pour suivre la question de la collègue, qu'est-ce qu'on devrait faire spécifiquement ou qu'est-ce qu'on va faire spécifiquement pour les employés des compagnies aériennes ferroviaires pour contrôler les symptômes? Est-ce qu'ils vont prendre la température? Est-ce que donc c'est à eux que revient ce fardeau-là? Pouvez-vous juste concrètement nous dire ce qui va se passer à partir de lundi dans les trains et pour les compagnies aériennes?
Oui, merci pour la question. Comme Dr Tam a dit, nous continuons à travailler étroitement avec nos collègues de Transport Canada, aussi avec les compagnies de lignes aériennes, aussi comme Via Rail, pour élaborer exactement c'est quoi les protocoles. Donc, il faut attendre un peu parce que c'est juste annoncé et les détails vont sortir bientôt.
OK, mais juste pour précision, là, puis ensuite j'aurai une question suivie. On entend beaucoup de témoignages de lecteurs qui disent que ça fonctionne pas à l'aéroport, que les gens passent, que c'est qu'il n'y a pas vraiment de filtre de contrôle. Donc là, vous venez ajouter un fardeau supplémentaire à une situation qui déjà semble problématique. Puis juste ma question suivie aussi, Dr Njoo, qu'en est-il de la chloroquine et de l'hydroxychloroquine? Est-ce que le Canada a une position à ce sujet-là? Est-ce qu'il y a des tests cliniques qui sont menés? Pouvez-vous juste faire le point là-dessus?
OK, merci. C'est deux questions. Concernant les protocoles pour, comment dire, à nos frontières aussi pour les compagnies, comme j'ai dit plusieurs fois que oui, on a toujours un système, c'est ce qu'on fait à nos frontières, même avec surveillance aussi pour les passagers avant embarquement pour un avion ou même pour un train maintenant, peut-être à part de lundi. C'est fait partie seulement une couche d'un système avec plusieurs couches et un système intégré parce que c'est pas seulement à nos frontières ou avec un transport en commun, on va garantir qu'on va pas, on va prévenir tous les cas d'infection. C'est aussi tous les ordres du gouvernement, mais aussi, comme j'ai dit, c'est aussi tous les Canadiens, Canadiennes, parce que tout le monde a une part à jouer, un rôle à jouer. Si on est malade, on demande des gens qui sont malades de rester à la maison. Prenez pas le transport en commun. Ça, c'est la première chose. Deuxième, oui, on veut garder le personnel des compagnies de lignes aériennes. Si quelqu'un est visiblement malade avec des symptômes, on va interdire de prendre le vol. Mais c'est seulement un aspect. À part de ça, c'est aussi important. Si on trouve quelqu'un qui est malade, la personne va directement en auto-isolement. Peut-être je peux aussi élaborer parce que nous autres, les frontières internationales, c'est une mandat, c'est une responsabilité du gouvernement fédéral. Donc, pour tous les voyageurs qui arrivent à nos frontières internationales, peut-être sur le train avec les États-Unis ou aussi à nos aéroports, on a vraiment deux aspects. Les personnes qui sont symptomatiques malades, on va prendre soin. On va les mettre dans un hôtel ou un autre établissement sous le contrôle du gouvernement fédéral où on donne des directions vraiment très claires et sévères. Vous êtes en quarantaine, il faut aller tout de suite directement à votre maison pour isolement, pour se mettre en isolement. Pour les gens, les voyageurs qui sont asymptomatiques, qui ne sont pas malades, aucun symptôme, eux aussi, ils doivent rentrer tout de suite à leur domicile et rester là, parce qu'ils sont sur un ordre de quarantaine fédéral. Okay, I can't remember what I said.
Thank you.
Screen at airports or just for domestic, what we've been saying is that any screening, be it at our international borders, at the airports, or even now domestically at train stations or people boarding a domestic flight, is only one aspect. It's never 100% guaranteed that we're going to stop further transmission of infection. Personnel at train stations, even at the airports, looking at passengers about to board domestic flights, they'll be doing what they need to do in terms of looking for people who have symptoms of obviously illness, if people look unwell, but that's never a guarantee. We know people can hide symptoms by, for example, taking a Tylenol or so to mask a fever. And so at the end of the day, I think it's not just a responsibility of governments, airline companies, train companies. It's a responsibility of every Canadian. If you are sick, stay at home. Don't take the chance of exposing others to the infection that you have. So I think that's about as clear as we can say it, and we've said it many, many times, and I think it bears repeating. So the other point I was making was that for travelers who come at our international borders, that is under federal responsibility mandate. So it's very strict since obviously March 25th when we put a new order in. All individuals, travelers who come to Canada from outside are subject to a mandatory quarantine order. And that's very straightforward. If we find you at the border, I mean collectively the Government of Canada agents, and you are sick, we will either put you in a federal quarantine facility and look after you and make sure that you get the proper care and treatment, or if you have mild symptoms, we will arrange for transportation to get to your home for immediate isolation, to not leave your residence until obviously you're declared to be recovered. For those travelers who come at our border who do not have symptoms, who are looking and feeling well, they are also under a federal quarantine order. And they are also ordered to proceed directly to their residence and stay there. As I said before, that means very strictly that they should not be leaving their property. They should arrange for family and friends to get groceries for them. It's quite strict. To be honest, one of the things that we recognize and we're working through with provincial authorities is that at the end of the day, it's a federal order, but these people live in provinces and territories. And so obviously what happens in Nova Scotia, it may be in a rural setting, someone has a farm, it may be obviously easier to comply with the federal order and stay on your property than if for example, you live in a condo in Montreal. We recognize it and we're working through that as well. Thank you. La prochaine question pour Français pour hydroxychloroquine. Je sais des essais qui sont en train d'examiner si c'est un traitement efficace, mais à date, il n'y a aucune évidence que l'hydroxychloroquine est un traitement efficace pour le traitement de COVID-19 et c'est quelque chose, on suit aussi l'évidence et les autres expériences scientifiques à travers le monde et aussi au Canada, mais je peux aussi dire que c'est important que les gens reconnaissent que c'est un médicament important pour traiter les autres conditions. On ne veut pas avoir une pénurie d'un médicament important pour les autres conditions médicales parce que tous les gens pensent que c'est peut-être un traitement pour le COVID-19. Il n'y a aucune évidence que l'hydroxychloroquine est un traitement efficace pour le COVID-19, mais on sait déjà que c'est un traitement efficace pour beaucoup d'autres conditions médicales.
Thank you, Dr. Njoo. Operator, we'll take one more question on the line before coming back to the room.
Thank you. Once again, please press star 1 on your telephone keypad if you have a question. De nouveau, n'hésitez pas d'appuyer sur l'étoile 1 pour toute question. The next question is from Kira Ferguson from Sudbury.com. La prochaine question est de Kira Ferguson de Sudbury.com. Your line is open. Votre ligne est ouverte.
Thank you so much for your time. I was just wondering what, I know obviously our travel restrictions in place for travelers coming over the border in any direction, but for our cross-border workers, what restrictions are being placed on them in one direction or the other?
So those that are providing some of the essential services or that their daily work happens to be across the border, even though they have we are not asking them to stay in a certain place for the 14 days. There are strict directions to them of self-monitoring. They have to avoid crowds, do all the social distancing measures that we expect everyone to do, and monitor the symptoms and report them. We're also have been in touch with employers for setting up measures to monitor the employees as well. So if you are going across the border for any reason, there's a collective responsibility on behalf of the employee and the employer and the governments who are trying to ensure the safety of each other's citizens. And so it is not to say that these workers can do whatever they want. They must essentially self-isolate as much as possible. They have to do the social distancing and monitor the symptoms.
Okay, but there is, as you said, obviously no strict isolation, no 14-day isolation upon their return. They are welcome to attend a grocery store or seek other services in town if necessary?
So the direction is to avoid crowds and avoid contact with the public as much as possible. Say, if you were a pilot that's just come in, and of course you have to fly back out again, in order to do your job. But what public health is telling them is go straight to your hotel, do not leave the hotel, get your food ordered, and go back on the plane, basically.
Perfect. Thank you so much. If I may, a follow-up question.
Sure.
Are there any additional cleaning measures in place for the products crossing the border, as there are concerns that the virus could remain on the products themselves? I apologize. Products or goods or services being shipped, not services, but goods being shipped across the border to the U.S. or those being received into Canada. Are there any additional cleaning measures to these products before they're distributed to the public?
We'll follow on that because obviously is to do with other departments, but we work very close with them, and we can get the answer to your question as a follow-up.
Thank you.
Thank you. We'll take a question now from the room.
Hi. Yesterday, the health minister talked about how they were trying to procure ventilators at a federal level for all the provinces and territories, but mentioned that there were a couple provinces and territories in particular that were trying to order these themselves, so that they weren't getting them through the federal government. Do you know what provinces those are, and what's the problem with that?
Well, I think obviously different provinces can procure different products. At a time when there's a general scarcity in supply, we absolutely encourage jurisdiction to come together and be part of our collective purchasing. So that doesn't necessarily preclude jurisdictions, but there's many advantages in being part of the bulk purchasing because everyone is looking for the products, and if we pull our requirements together, we will stand a better chance to get access to some of these as well. So the federal government can help with if the product comes from another country, one can help facilitate some of those access and transportation and distribution, for example. So it's a collective measure, but we cannot essentially dictate what individual jurisdictions might do, but collectively we stand a much better chance to get access to scarce resources. But on top of that, the federal government has added an extra layer of protection, which is even if no orders have been placed for the provinces and territories, we're actually purchasing them preemptively should they be required.
So sorry, what provinces are going out on their own and getting their own ventilators rather than federally?
I don't have that specific information, but we certainly encourage everybody to be part of that purchase order.
And the data you just mentioned that was uploaded on your website last night, can you tell us what your big takeaway from that is that Canadians should know when you look at that new data, what kind of a picture it paints?
Well, I think certainly this is a serious illness. And so the picture it will paint is that there are definitely serious consequences of hospitalizations, ICU, care requirements, as well as, of course, the mortality or the deaths. So, but I think it would also tell us that even though some of the severe impacts are the older population, it doesn't mean that the younger population isn't impacted. The bulk of the illnesses are actually in the younger age groups. It's just that, and some severe illnesses do occur, but while the heaviest impacts are on the older age groups. I think also it is there to set a sort of national trend to see where things are trending. And as I've just said, well, BC, of course, is an area that was first impacted, but it will show you the curves for each of the jurisdictions and where the cases are. So if you click on the map, yes, it'll show you the number by province, but it'll show you the sort of numbers over time for each of those jurisdictions as well. So trending, so national surveillance is important for trends. And there'll be some sort of, as I said, sort of age group breakdowns as well. I just want to emphasize that, of course, if the trends are slowing down a bit, our key message, though, is not to sort of relax. Our key message actually is to double down, absolutely double down. And that right now is an absolutely critical time. And if you looked at those numbers, you realize that we're definitely not out of the woods, and we got to keep going. Donc, lâche pas la patate.
Thank you. Next question in the room. This will be the last one.
There's some reports in the United States that the CDC is going to recommend this week that all Americans going out in public are going to wear masks. And while we've talked about masks before not being wholly effective for members of the public, if the CDC were to go ahead with this, is that something that perhaps will be headed to in Canada? And can you just speak about whether that's something we should be considering?
Well, we'll always evaluate new data as it comes along. Our position right now is that put a mask on someone with symptoms if they should need essential services. Like if you have symptoms, you have to stay at home. You should not be wandering around the community. If you need to get to a medical facility, at that point in time, that mask might actually be useful because you now have infectious droplets that you might send to others. But the key is to keep that 2-meter distance. Masks have to be utilized appropriately too. Most people haven't learned how to use masks. So there's many practical aspects of this. So our advice right now is there is no need to use a mask for well people.
Okay, merci. La séance est maintenant terminée. Thank you.